Hello, I'm Dr. Castanet. I'm going to talk to you about spinal stenosis in this video. Spinal stenosis literally means narrowing, and it's a reference to the holes that run down the center of the spinal canal or the holes that exit on the sides. Now, the spinal cord runs down the central canal from the skull down to the upper part of the lower back. Beyond that, the nerve roots continue down to the tailbone area. The little holes on the sides of the spine are the holes through which the individual nerve roots exit after they come off of the spinal cord. So you can have narrowing either of the central hole or of the two little paired holes that exit on either side of the spine at each level between each vertebra. We term the narrowing of the central canal that goes down vertically from the skull to the tailbone area. We call that the central canal, and narrowing of that canal, central stenosis. That's typically what is meant when the general term stenosis is used. We term the narrowing of little holes on the sides lateral stenosis or foraminal stenosis. The foramen is the little hole, just the name for the little hole on either side, and the plural of that is foramina. So we refer to narrowing of those little holes on the sides as foraminal stenosis. But when we speak of a problem that is stenosis generally, we generally are referring to central canal stenosis. Central canal stenosis has different significance depending on what part of the spine we're speaking of. When the central canal is narrow in the neck area, it can make the space very small for the spinal cord, and it can compress the spinal cord and result in pathologic changes to the spinal cord, both anatomically and functionally. So that if, for example, the spinal cord is compressed in the neck area, it can cause problems with finger dexterity, with our coordination and our gait. It can cause bladder problems, and it can result in different reflex changes that we note on physical examination when we examine the person. What's sometimes a little surprising to patients about stenosis or narrowing in the neck is that very often it's not symptomatic. The person may not have neck pain, they may not have any symptoms in the arms, which is typical of a pinched nerve that involves narrowing or pinching of the nerves as it exits the sides. That can make it very difficult for patients to understand and to appreciate the need sometimes for surgical treatment to take pressure off of the spinal cord. But the spinal cord is critically important, and that is sometimes a surgical emergency even if you're not having any symptoms. What's more typical in the way of stenosis and use of stenosis among patients is the reference to stenosis or narrowing in the low back area. When the low back canal is narrowed and stenotic, it typically results in a person who has difficulty walking for any length of time. They typically have difficulty standing straight up. They may rest on a shopping cart when they're shopping, because that enables them to bear some of the weight of their trunk and to bend over at the waist and to bear some of the weight on the shopping cart. Those are classic signs of somebody with central stenosis in the low back. A person with central stenosis will typically begin to have pain and weakness in the buttocks and thighs and legs. It may alternate side to side, be worse on one side or another, but eventually it'll probably involve both sides. The things that make the canal narrow in the low back or in the neck are typically, firstly, there are a number of people that are born with a small canal. They just have a small hole to begin with. Sometimes this happens with professional football players, and then when they incur an injury that results in a problem with the nerve root in the arm or leg, they will get an MRI scan, and that may be the first time that it's noted incidentally that they have a narrow canal in the neck or the back. There have been several football players that were encouraged to retire even after they recovered from an injury because they were at risk for spinal cord injury because of the small canal they were born with. More typically, however, it's not that people are born with small canals, but that they acquire degenerative changes that result in enlargement of the bones and the ligaments and the discs that take up the space that was previously available for the spinal cord or nerve roots. And it's those degenerative changes, sometimes superimposed on a congenitally small canal, that result in the person experiencing symptoms and having signs of narrowing. So what to do about this? Most of the time, certainly in the early stages and often in the middle stages, people can be treated non-surgically for this. There are certainly exceptions to that, particularly in the neck. In the neck, it can be a rather serious risk to go without decompressing the neck, but it can be monitored for a while, and if the person is not progressing in terms of symptoms or physical exam findings, you can often wait until later to see if and when they need surgical decompression of the neck. In the low back, if the stenosis is mild and sometimes moderate, you can certainly treat it non-surgically, and in our practice we use spinal decompression, which is a very sophisticated form of traction to separate the vertebrae, make more space. We're just speaking millimeters, but millimeters difference can make a difference in how somebody feels clinically. So we will typically treat them non-surgically, certainly in the early stages of spinal stenosis. But it's not until the spinal stenosis typically gets severe that it needs to be surgically compressed, or decompressed rather. And that is relative to the variety of spine surgeries that are often done. That's not a big, significant spine surgery. That's a relatively simple surgical procedure that can be done by a number of spine surgeons, and with generally a very good outcome clinically. So that is the topic of spinal stenosis. Of course, the particulars and details depend on your case, and I'm just providing some general information about spinal stenosis and framing the way in which you should think about spinal stenosis. Early on, it's non-surgical and should be treated that way, but at some point, when it becomes severe, then it's appropriate to do surgical decompression, and that's especially important when we're talking about spinal stenosis or narrowing in the neck region. Thanks very much.